Let's take a look at rating the specified benefit plan. You can utilize software, and Golden or GTL's got it on their site out there, okay? But I'm going to use the paper rates today just to show you the ease of use because that's what I like to use when I'm out in the field. Let's use a 69-year-old couple. If I'm going to go out there and write them just a simple little plan, I'm going to supplement their Advantage plan out there. So I'm going to write them a Plan A. Since they're 69, I can go down here to the family plan. 66 to 70, my premium for that would be $199.60. Now that's my base plan for the cancer. Now I got to add the heart attack and stroke riders. So again, I go to the family plan, 66 to 70, $418.80. Add the two of them together, I'm at $618 of annual premium so far. Now let's just stop right here and think about this. If I wanted to stop right here, I got a nice little plan for this couple. And I can show you the benefit under this plan to show you how strong it is. I'm going to use my heart attack and bypass surgery I had back in 2006 for an example. My bill was huge. I had a $6,000 maximum out-of-pocket policy. Needless to say, I paid the $6,000. Now let's assume that I had Plan A, which at that time would have cost me less than $500 a year with return of premium on there. And that'd be for my wife and myself. When I went in there, I was in the hospital for 9 days. My hospital confinement benefit would have paid $900. My daily room benefit would have paid $900. Drugs and diagnosis, I had one of them every day, so that would have been $90. My attending physician every day. I would have got full surgical benefits, anesthesia, ambulance, blood. Family transport would have paid $500 for my daughter to come back from California to see me in the hospital. You know what? I would have collected $5,780, pretty close to covering my $6,000 out of pocket. Of course, I didn't know about this product at that time. I didn't find out about the product until I was in recovery. In fact, I wasn't even driving my own car yet. My wife had to drive me. She drove me to the agent meeting that day, and I listened to him talk about this product. I did some notes on it, some calculate, and I walked back out, and I was telling my wife about it. And she said, "Buy it." And I said, "Well, I can't qualify for it now." She said, "Buy it for me then." A year later, when she was in the hospital from her heart attack, I kind of wish I had taken the time to buy it for her. But let's go back to our couple because we can already see this is a pretty strong little policy for the clients. I like it better than a lump sum cancer just because it keeps paying. It'll pay for another heart attack or stroke or cancer at a future point. If I wanted to on this policy, I could now add a lump sum benefit. Let's take a look at this now. This couple was 69 years old, remember? So if we went down here and we started looking at a $5,000 benefit, where would we be at? $5,000 benefit would be $96.90. So we're at a family right here. 66 to 70 years old, $96.90. If I want 5,000, multiply it times 5, that'd be $484 a year. My client said, "Nah, I think I'll pass on that." Then I looked at return of premium. This return of premium says we'll return all of the premium you paid after 20 years or at age 75. At these clients' ages, we're looking at 1.41 factor. That brings my 618 up to 871. If I take this and multiply it times the monthly factor, because again, I like monthly premiums, I'm looking at $36.62 each for Plan A coverage with full return of premium on a 69-year-old couple. You know what? There's nothing wrong with that premium. You can go out there and sell that kind of premium all day long. If they're sitting out there and they're going to save $100 jumping to that Advantage plan, the risk they've got is something serious happens to them and all of a sudden they get hit with the whole out of pocket, just like I did in mine. So why not take about a third of that savings and purchase a plan to hedge their decision a little bit? And you know what? If you got a client that's sitting out there already in an Advantage plan, they're going to love it, okay? If you have a client that's with a med sup right now and you're showing them this, a lot of clients are going to say, "Okay, so I could save $100 going over to this plan and I could buy this policy to hedge my bet a little bit. I'll do it." And all of a sudden you got the commission on 2 sales instead of 1. So this is a real strong plan when you're dealing with clients out there. And I have to tell you, the application is just as simple. When you look at the application, just like the previous applications we've looked at here in A2, that one application qualifies for everything, okay? All you have to do is fill out the applicant's information, go down there and fill out what coverage selection and premiums that you sold them. As far as the health questions, take a look at them right there. Do you have a qualified comprehensive medical plan? Okay. Notice if they answer no, do not submit the application. In the last 10 years, have you been diagnosed, received meds for it, or been treated for any of these? Okay. If they answer something to 2A and say yes to it, don't submit it. If they answer something to 2B, don't submit it. 2C, okay, if they had one of these, they can buy the policy as long as they don't buy the heart attack and stroke rider, okay? In the last 24 months, have you received any medical advice for any of the diagnostic questions listed number 2? If yes, don't submit. Otherwise, as long as your client can answer the right things here, they're going to get issued. That's about as easy a health questions as you're ever going to see. Just an idea of some sample plans that you could use this for. Let's look at a 45-year-old self-employed person. We're just looking here to give them some additional dollars in the event of a critical illness. I go up there, schedule benefits, plan A, again I'm using 6420, add the heart attack and stroke rider, multiply times 1.29, I'm looking at a $228 annual premium for that coverage. You know, that's pretty cheap when you think about it. That's nice and simple. Let's say you got a 60-year-old client out there who just left his position at work. Now he's buying his own health insurance, and he's finding out that low deductible health insurance is really expensive. So he's considering going to a higher deductible health insurance. Well, one of the ways he can hedge his bet is using this policy. And if I go out there and write him again, plan A, because I'm only looking to cover here, typically less than $6,000 out of pocket. I can go out there and write a plan A with return of premium. Oh, without, because this client wouldn't keep it after he turned age 65. So without return of premium, I'm looking at $23.15. Nothing wrong with a little policy like that. Let's take a 78-year-old that a supplement just went up to $380 a month, and nobody's willing to rewrite them. Everybody that you know that writes med sups is going, no way, we're going to touch him with a 10-foot pole. He's kind of stuck, isn't he? He's stuck there in that supplement because nobody's willing to accept him. So let's go out to him and say, how about if we move him to an Advantage plan? Let's say I can offer him an Advantage plan at $47 a month. You know what? That's a lot of savings, isn't it? And then we turn around and supplement it with one of these plans. We take 148 for scheduled benefits. We're just looking at a single person here now. Then we add the heart attack and stroke. We multiply it times the return of premium factor, and I'm looking at $50.22 a month. Now, I'll tell you what, if you're looking at saving over $300 a month and you can hedge a lot of that bet for $50, nothing wrong with a policy like that, is there? Let's look at a 45-year-old whose dad died young of cancer. So when I came out there and I quoted him a plan A, 6420, 110, and didn't bother with the return of premium on there. Added it all up, it was $14.91 a month. And the guy turned around and said no. Then he was looking at my page as I was pricing out. He says, how much would that expensive plan cost? I went over to option D and I used the option D plan on it. And I'll tell you what, he took a look at that $47 premium and he said, let's do it. I asked him why. And he said, you know what? My father would have lived longer if he had tried a new experimental treatment out there that later on we found out it worked. But his insurance company said he wouldn't pay for it, and he wasn't willing to pay for the money out of his own pocket and take a chance at leaving mom less money when he died. So he went without the treatment. And I thought about that as I was driving to the next appointment, and I thought, you know what? All of a sudden, that premium really doesn't look like much when you think about it in that scenario. Let's go back and use my claim again, and let's see what that option D would do. We went through my claim. It came up to be $5,780 worth of benefit. If I use the option D benefits on the same claim, I'd have $21,250. So that's 4 times, right? Let's go back here and look at. I'm comparing $14.91 a month premium compared to $47.86. You know what? That $47.86 doesn't look like a whole lot of money now, when all of a sudden you start looking at a benefit like this coming out. You know what? Again, this presentation is not to be shown to any consumers out there. And the presentation that I'm showing you right now, I'm going to replace this slide with something else, and we'll see what we'll do here. I'm going to back it up to this slide. As you can see, this is a nice, simple, easy little plan. Again, it's only going to be available to you until which point in time critical care is okayed in your state. But I'll tell you what, take this out and have a little fun with it. It's a great plan to offer people. This finishes up the rating and the software and the application and everything for the specified benefit plan. From this point in time on, I would go take a look at the marketing concepts and see how you can go out there and make some money with A2. Thank you.